Hello, I'm Russell Visser, returning again from Northwest Physiotherapy Group. We're here to present the physio files, and today my colleague Graham Nelson will talk about one of the 5 main causes of leg pain. Today he's going to discuss shin splints or shin soreness. Thanks, Graham.
Thanks, Russell. So I'm here today to talk about shin splints, which is part 3 in our series of top 5 causes of leg pain. So what are shin splints? Shin splints are pain or tightness that's felt in the lower leg, on the front or side of the shin. So you can get shin splints on the outside of the shin here, or on the inside of the shin in this region here, and they can extend further up the leg, but they're mainly in the lower part of the leg. Now they're mainly brought on with weight-bearing activities or exercises such as running, walking, or even standing, and sometimes they might be felt in sports such as football, soccer, or those sports, particularly if the ground's fairly hard.
Graham, how do you know when you've got shin splints?
Very good question, Russell. Shin splints generally start off slowly or insidiously. There's generally no trauma or cause that can be identified, and you might notice the pain or the tightness in the shin starting to develop when you begin an exercise such as walking or running, and then it might get a little bit better as you warm up, and the pain might even disappear as you get more into the activity, and then it might be a bit sore as you cool down, and it may be sore after an activity that night and even the next day. So as this becomes more severe, if you've had it for some time, you might notice that the pain persists for longer during an activity, and it might actually get to the stage where it stops you from running or performing in your sport. And then it's become a bit more serious, and it might interfere with your training and your continuation of your sport.
And Graham, what are the causes of shin splints?
Okay, so shin splints are generally caused by an overuse reaction or a loading reaction, and this occurs at the junction of the bone and the muscle. So where the muscle attaches to the bone in the shin region, and that's called the periosteum. So the periosteum becomes inflamed, becomes irritated, because the muscles that attach to them are pulling on the bone in an excessive manner. Okay. Now, why does that occur? Usually that occurs because the muscles are working too hard. All right. Why are they working too hard? It usually is because of poor foot mechanics. Okay. Particularly if someone is an overpronator, that forces the leg to rotate in and the longitudinal arch of the foot to collapse. The muscles that counteract that are the calf muscles, and they attach to the shin bone. So if they're working excessively hard, they're causing a pulling action to occur on their attachment to the bone, and over time, if that is excessive, that can cause irritation and inflammation. So if this problem continues, it can actually develop into a loading reaction in the bone itself, and this can lead to micro trauma to the bone and stress fractures developing in the bone itself, and that's when it becomes a bit more serious and is likely to stop you from your sport. Another cause of lower leg pain in that area is compartment syndrome, and that needs to be differentiated between with shin splints. So compartment syndrome generally affects the muscles in the calf and their inability to expand because of tight compartments or fascial compartments in the leg, and that causes a different sort of pain in the leg. It's a bit different to shin splints, and the two need two different treatment approaches.
Graham, what can I do about shin splints?
Okay, there are a few things you can do in the early stages, and it's best to get on top of this problem early because it can progress quite quickly and become a long-standing issue. So initially, if you notice that your pain comes on doing a certain activity, such as running, you can reduce your running load, so run less frequently or for a shorter amount of time, and monitor the response there. You can also have a complete rest from the aggravating activity, for a week to 2 weeks, maybe even longer. In that time, it's beneficial to do some icing of the area, particularly along the inner border of the shin here, So just with a cube of ice, you can actually just run it along the inner border of the shin here, and do that, say, for 10 or 15 minutes. So the other thing you can do is some stretches for the calf, and the two main muscles you need to stretch. One is the outer calf, called the gastrocnemius, and the other stretch is for the deeper muscle, called the soleus. So to stretch the gastrocnemius, you would have a straight knee, and the one you're stretching is the right leg, and you make sure you keep your heel flat on the ground and pushing the knee back and just lunging forward. So that's to stretch the gastrocnemius, the outside muscle, and then to stretch the inside muscle, you would just simply bend the knee like that towards the ground, still keeping the heel down on the ground. So these stretches you would do holding for at least 10 to 15 seconds, and you might do half a dozen at a time, particularly before or after activity, and throughout the day as well. So if this problem persists beyond these measures you've trialled for the first phase, then I would suggest that you need to have a thorough assessment of the problem. Now, in this assessment, you would probably see a physiotherapist for this, and they would need to assess your lower limb biomechanics, also your foot biomechanics, how that moves, and any muscle imbalances that exist in the lower limb, and could also trace back to the core muscles, the lumbar spine, and generally how the lumbar pelvic region moves also. At Northwest Physiotherapy Group, we've got a specialised gait assessment tool. It's a force platform that we get patients to walk over, and that tells you about how your foot mechanics are working. So we can quite easily diagnose this problem if it exists. So for more information about this, you can go to our website and have a look under Gait Scan in the services section, or contact us at Northwest Physiotherapy Group on 9370 5654.